So I know earlier I mentioned, the higher prevalence of TMD when it comes to the adult population and women versus men. But I have to tell you, the other area that really gets underserved is children. So the pediatric population, you will be surprised, can have a fair amount of early temporomandibular issues going on. Again, maybe it was from a fall or a trauma from ice skating, maybe getting hit in the head with a soccer ball or a basketball, or contact and concussion from football. But it is a population too that I find, especially the younger children, also have a hard time articulating their pain. So sometimes, as a practitioner, when these children come into your clinic, you have to really do a good job of speaking their language and helping identify what might be an underlying problem. For example, like bilateral chronic tension headaches. There are a lot of children suffering with headaches that they're maybe not so good at articulating exactly what is going on. So by doing a proper evaluation and assessment, you can tease those things out. And the other area that really excites me a lot is sleep medicine. And as physical therapists, we have a very crucial role in at least being a proponent to observe someone's airway. So again, with children, we like to do a good, thorough evaluation of the oral airway. Do they seem to have a restricted airway? Are they tongue-tied? And therefore, their swallowing mechanism will be off. And in order to swallow properly, their integration of the wrong muscles to achieve those functions, and they tend to carry themselves in a different head posture. Looking at the airway for tonsils, are the tonsils inflamed, and is that something that should be addressed? And again, multidisciplinary, getting them back to their pediatrician possibly, or pediatric ear, nose, and throat to help further assess those situations. So again, looking at our children and really, at least in my mind, setting them up for success at an early age, identifying potentially a small problem and really teaching them now is the time when you're young to manage the situation so it doesn't become a chronic situation into adulthood.